Now I'm going to talk about the second part of the cardiovascular system. The first thing we need to talk about is the systemic circulation. As I say, the systemic circulation usually by the aorta, the first part of the aorta, which is the ascending part. Then we have this part here, which is the aortic arch, and the last portion, which is the descending portion, and usually is divided into thoracic, and we have the abdominal portion, and the blood is going to pump through the aorta and going to return back through the cranial and caudal vena cava. So the blood supply of the head usually through the common carotid artery. For the forelimb usually will be through the subclavian artery, and usually this artery inside the thoracic is called subclavian. Once exit the thoracic cavity and bend around the first ribs will be called the axillary, and usually the blood supply will be through the axillary for the both of the forelimb. So this is the artery, and we can see here this is the carotid, and this is the subclavian, and this area here the name is changed to axillary. This is the thoracic aorta, and this is the abdominal, and this is the external iliac, which is going to supply the hind limb. This is the aorta. This is the first part, which is ascending. This one here is the arch, and you can see from the arch we have the brachiocephalic trunk, and we have the left subclavian, and from the brachiocephalic we have the right subclavian, and we have a right and left common carotid artery. This is true in the dog, but if we consider other animals, for example in the ox and the horse, we can see there's only one branch that exit or emerge from the aortic arch, which is the brachiocephalic, and the brachiocephalic will give us the right and the left subclavian, and will give us the right and the left common carotid artery. Similar here, brachiocephalic, okay, right and left subclavian, and right and left common carotid artery. And you see in the dogs and pigs, we can see that the left subclavian emerge separately from the brachiocephalic. Again, this is the same picture. You can see this is the blood supply for the head common carotid, subclavian, thoracic, and abdominal aorta. For the subclavian, which is the right and left subclavia, there will be 4 branches. The easiest one that we can see just found dorsal to the sternum, that will be the internal thoracic artery. And we can see here we have the vertebral artery, this one here, which extend through the transverse foramina to reach to the level of the brain, and we have these which supply the ribs and the vertebra, which is the costocervical trunk, and the last one here from the subclavian which is the superficial cervical, which is going to supply the lymph node that found in the forelimb. So we have 4 branches of subclavian. One important thing, we have right and left subclavian. For each of these subclavian, we have 4 branches. We have the vertebral, costocervical, internal thoracic, and finally we have the superficial cervical artery. For the aorta, I say that we have the descending aorta. We said we have thoracic portion and we have the abdominal portion. Thoracic going to supply the structure that found inside the thoracic region, whereas the abdominal aorta going to supply structure that found in the abdominal region. So this is the diaphragm. So this one here, the thoracic, whereas the one we have here, we have the abdominal aorta. For the veins, the blood returns to the heart through two veins. We have the cranial vena cava and we have the caudal vena cava. The blood returns from the head and the forelimb region through the cranial vena cava, and the blood that returns from the thoracic, abdomen, and the hind limb through the caudal vena cava. So the caudal vena cava is much larger than the cranial vena cava. And the blood return of the blood that supplies the heart through the coronary sinus. So the cranial vena cava is formed to close entrance of the chest by the union of the external jugular vein and the subclavian vein. This is the vein, the external jugular, and this is subclavian. So the fusion between them result in the formation of this vein, the smaller vein. This is the cranial vena cava, and the blood that retain the blood of a hind limb, this is the caudal vena cava. The caudal vena cava is formed in the abdomen near the pelvic inlet, and usually it's union of the right and left common iliac vein. So this is the iliac vein. We have one in the right, one in the left. The area of the union between them will result in formation of this vein, which is the caudal vena cava. Now we'll talk about the last thing, about the conducting system of the heart. In the heart, as we know, that the contraction of the heart is autonomous. That is not under the control of the nervous system. Nervous system can increase the heart rate or decrease the heart rate, but it not control the contraction of the muscle. Usually the contraction of the muscle of the heart is from the structure which is found within the heart. And usually this structure or the conducting system is composed of modified cardiac muscles. Modified cardiac muscle. These muscles, they lose their fibril content, which is the actin and myosin for contraction. They have higher glycogen content, and they have more intercellular fluid. This structure have three portions. We have the first one, which is the SA node, which is the sinoatrial node. Then we have number 2, which is the atrioventricular node, which is the AV node. Then we have number 3 here, which is the atrioventricular bundles, which is bundle is found in the area of the interventricular septum, and you can see these fibers is running ventrally, then reverse in direction toward the proximal portion of the heart. The same thing here, we can see one is going to the right side, one is going to the left side, and we can see this structure here, which is the trabecule of the septum marginalis. As I said, this is a shortcut from the septum toward the wall, as I said, to ensure fast and synchronized contraction of the heart. So this is the conducting portion. Okay, SA node, AV node, and this is the bundle of His or arterioventricular bundles. So the SA node, AV node, atrioventricular bundles, which is bundle of His, as I said, this is the one that found here, and usually they found in the area of the endocardial region. And usually these modified muscles is called the Purkinje fibers. The SE node, as I said, is located just below the endocardium of the right atrial wall. This is the area of the cranial vena cava, and we can see this is the area where we have the SA node. And usually when this polarized, okay, the signal is transmitted toward the AV node, and from the AV node is spread to the whole ventricular system, right and left ventricles. And usually if we have a problem with this one, because this one here is responsible for initiating the polarization, If we have problem with this one right away will take the control and will be responsible for the polarization of the heart and initiation of the heart contraction. After that, you can see through this bundle is transmitted into the apex of the heart, then it's reverse in direction. As I said, there is some shortcut to ensure fast and synchronized contraction of the heart system. See the right and the left? As I said about the septum marginalis. See the left branch is more diffuse because you need stronger contraction in the left side compared with the right side because it's going to pump the blood to the whole system.